Hi, my name is Amy Coward, and I'm a registered nurse with the Cleveland Clinic. I'm here to talk to you today about concussion management in children. Concussion management in children is becoming a growing health concern in the United States. The Center for Disease Control and Prevention estimates that 300,000 sports-related injuries occur each year. Contact sports, such as football, have the highest incidence of concussion. Re-injuring the brain during the recovery period can be fatal. It is important for parents, coaches, and players to understand the guidelines for returning to play in the event of an injury. Young athletes, specifically those involved in contact sports such as football, baseball, hockey, and soccer, have the highest risk. Injuries occur when there is an obvious forceful contact with the head despite wearing a helmet, or when there's a blow to the body that causes a loss of control of the head or neck, such as this. Symptoms include loss of consciousness no matter how brief, dizziness, vomiting, headache, and clumsiness and confusion. Concussions are categorized based on the severity of these symptoms, and they use a grading system. A grade 1 concussion is the least severe. There's no loss of consciousness and only momentary confusion. Basically, that's confusion lasting less than 15 minutes. A grade 2 is more severe. There's still no loss of consciousness, but the confusion can last greater than 15 minutes. A grade 3 is the most severe, and it involves any loss of consciousness, no matter how brief. According to the Center for Disease Control and Prevention, any injury that results in concussion-like symptoms requires that the player be removed from play and not return to play that current game. It is also recommended that the player be evaluated by a health care provider as soon as possible. Once the player is cleared to return to play, the return should be gradual. Coaches, players, and parents should follow the return to play guidelines. The first step involves the player being symptom-free for 1 week. That means no headache, no vomiting, no confusion, no clumsiness for 1 week. Once the player is symptom-free for 1 week, he or she returns gradually to play, starting with light aerobic activities such as walking. The player then may progress to sports-specific training, such as running, then non-contact drills, then full contact drills, such as hitting another player. And if they remain symptom-free during that whole process, the player may return to gameplay. If at any point during the re-entry process the player begins to develop symptoms, Step 3 insists that they return back to the prior step that they were in. So if Luke here had symptoms, was symptom-free in non-contact drills and then started a contact drill, he'd have to revert back to doing non-contact drills until he was symptom-free. Re-injuring the brain prior to recovery can cause irreversible neurological deficits. As parents, players, and coaches and healthcare providers, we need to quickly identify concussion symptoms and manage the injury. Being knowledgeable about symptoms and recovery can help us ensure a safe return to our favorite sports. Thank you very much.